Today I'm going to be doing oral care on an unconscious patient. So the first thing I would do would be check his mouth for any lesions, blemishes, broken teeth, like that. And I would assess his gag reflex. If that is present, I would proceed. If it's not, I would just use the sponge swabs on his mouth, lips, and tongues, and I would avoid fluids. I would gather all my supplies, and then I would provide privacy for him. I would introduce myself. My name is Maria Hurtado. I'm going to be your student nurse. I would ask for his name, date of birth, and if he's allergic to latex, but since he's unconscious, I would check his wristband for all this information. I would move the bed into working height, and then I would place a towel underneath his head, and then I would turn him to his side like that. And then I would get started. I would perform hand hygiene, and then I would put on my gloves. Put this underneath. Like the same with the tray underneath his cheek. And then I would get the padded tongue and I would hold it vertically, and then I would swab the top of his roof of his mouth and gums, and in between his cheeks I would get a new one and do the bottom, and then I would dispose of these, get a new tongue presser and do the other side, top, get rid of it, get a new one, do the bottom, and every time I would swab a different section of his mouth, I would get a new swab because I don't want to cross-contaminate. And then I would irrigate his mouth with either 10 milliliters of water or diluted mouthwash. And I would either let it run into the tray or I would suction it. And then I would apply water-soluble lip balm. I would avoid petroleum base because it would burn if he uses oxygen. And then I would get rid of the tray and I would pat his face dry. And then I would get rid of my gloves. And then I would turn him back onto his side, get rid of the towel, and then I would put the bed in the lowest position with the 2 rows up, the call bell within reach, and ask if he needs anything. And then I would perform hand hygiene, and I would document any abnormal findings and what I did today.